Hey mama, I'm Trish, and I need to tell you something that might tick off some people in the birth world. Birth doesn't have to be terrifying. It just needs to stop being a stinking mystery. After 16 years as a labor and delivery nurse, catching over 1,000 babies and birthing 6 of my own, I got fed up watching scared, unprepared moms walk into delivery rooms. So I created the birth education I wish every mama had. Real talk from someone who's been on both sides of that delivery room door. Right now, I'm giving you everything: my 3 signature birth courses, monthly support calls, my brand new birth pod class, and 30 days free in our mama membership. Plus, I'm shipping you my labor birth comb absolutely free. This little tool is a game changer for natural pain relief during contractions. That's over $4,300 worth of birth education, plus a physical tool delivered to your door. Your body was made for this, mama, but you need to know your options. Get the Calm Birth Bundle at labornursemama.com/calm, C-A-L-M, because confident mamas have better births. You get a 14-day money-back guarantee, lifetime access, and it's available right now inside our app. Stop letting birth be a mystery. Get educated, get empowered, get the bundle, and get your birth comb free. During the pushing phase with my first baby, Ian, the nurse suddenly gasped and she says, "Oh my stars, you have a patch of cauliflower down there." And I remember thinking, what in the actual heck does that even mean? Nobody explained it to me, and I was pretty young, so I didn't ask questions. And nobody, not even my mama, warned me what was coming. 3 days later, I'm home with Ian, and I could not sit down without crying. I couldn't go poop. It wasn't from the obvious places you would expect pain, but from my booty. And my tailbone felt like it was on fire. My booty grapes were awful. And sitting to nurse Ian was absolutely torture. Every time I tried to sit down, I'd have to bite my lip to keep from screaming. But here's what shocked me most. When I finally called my doctor about it, he said it was normal. It was normal. And this is what happens. Spoiler alert, it didn't go away. And after helping over 15,000 women through birth as an online birth educator and thousands of births as a labor and delivery nurse, I've learned that what that nurse saw were stinking hemorrhoids, which she called cauliflowers. A patch of cauliflowers to be exact. Plus, the tailbone pain and 6 other causes of postpartum booty pain are things that a lot of you might experience, but nobody talks about it. I'm going to walk you through the 7 reasons that your booty might hurt after birth, including what exactly that cauliflower patch really was. And more importantly, I'm going to give you some strategies that actually helped mine, which I didn't learn with my first baby, mind you, but I promise you, reason number 4 is something your doctor will never mention, even though it's completely preventable. But first, let me tell you why understanding all of this matters so much more than just your comfort. Look, I know what you're thinking. Trish, I just pushed a human out of my vagina. And of course, everything's going to hurt. And you're not wrong. It's going to be uncomfortable. But here's the thing that nobody tells you. Postpartum booty pain isn't just about discomfort. When your tailbone or your entire butt is screaming in pain, you have a really hard time even holding your baby comfortably. I would stand to nurse Ian for those first couple weeks because sitting on my bottom was unbearable. I couldn't drive to the pediatrician without wincing at every stinking bump. And back then, we did not have Amazon so that you could order things. But I am going to have a list of booty pain relievers in the show notes. You can't even enjoy those first precious moments moments because you're constantly shifting and crying and wondering what is the actual stinking problem with my bottom. And even if you're thinking, I haven't given birth yet, trust me. Trust me, whether you're watching this on YouTube or listening to it on the podcast, do not hit pause. I know you might be like, holy crap, Trish, you're scaring me to death. But I really don't want to scare you. I just want to teach you because 3 of these 7 booty pain causes are 100% preventable if you know what to do before labor starts. I didn't know about them with Ian, but I did with my later babies. Thank you, Jesus. And the difference in my recovery was night and day. Although I am going to tell you what happened to me with Lainey so that you can understand where I'm coming from there. Now, before we go any further, I want to say it again. I am not here to scare you. Birth is beautiful. Y'all know I love birth. I've had 6 babies and labor is incredible and your body was designed to do this. But I am here to educate you because knowledge is stinking power. When you use it, when you know what's normal, what's common, and what to do about it, when you know how to speak up, you can actually prevent so much of the unnecessary suffering that we have because of stupid policies and procedures and other things. But that's a whole nother episode. That's what I wish someone had done for me. So don't worry if you're already dealing with this booty pain. I've got some solutions for you for each cause that causes it. The same ones that finally let me sit down without crying. And here's the best part. 5 of these fixes you can start today without spending a dime or waiting for a doctor's appointment. Okay. Cause number 1 is tailbone trauma, which is also called coccyx injury. During a vaginal birth, your baby's head puts direct pressure on your tailbone as they move through the birth canal. In some cases, the tailbone can actually fracture or get bruised or move out of position. Now, here's what most women don't realize. Your tailbone has nerves that connect directly to your pelvic floor muscles. So when it's injured, it doesn't just hurt to sit. It can cause shooting pain down your legs during bowel movements, and even pain during sex, which really sucks, right? Months later. With my 5th baby, Lainey, she came out what is called OP, occiput posterior, which means she was face up instead of face down. This position puts extra pressure on your tailbone during delivery. My sweet little daughter, Lainey, told me later on when she was a teenager, and I'm quoting her here, she didn't want to look at my butt, meaning Lainey rotated to avoid facing my back. But in doing that, she injured my tailbone, which obviously wasn't the reason. But for months after Lainey's birth, I could not sit on hard surfaces. The pain would shoot up my spine every stinking time I sat down too fast. Physical therapy did help, but what really changed everything was learning some right sitting techniques that they taught me and understanding like this wasn't my fault. It was just how she was positioned. But the best fix for this is get a donut cushion, but not just any donut cushion. You want one with a cutout that is completely removing pressure from your tailbone. And we'll link to some in the show notes. Second, practice the tilt and sit technique. This is what she taught me. Before you sit, you tilt your pelvis forward slightly, then lower yourself slowly while keeping your weight on your sit bones, not your tailbone. This sounds simple, but it was a serious game changer for me. Third, alternating ice and heat, 20 minutes of ice to reduce inflammation, then 20 minutes of heat to relax those surrounding muscles. And she had me do that like 3 times a day for the first 2 weeks. Now, if your tailbone pain is severe, like you cannot sit at all, there is a specialized treatment that most doctors don't tell you about. And I'll cover that when we get to cause number 5 because they're actually related. But first, let's talk about the cause that shocked me most with Ian. So let's talk about what that nurse saw when she gasped during my delivery with Ian. Hemorrhoids, not cauliflowers, specifically external hemorrhoids that she kindly referred to a patch of cauliflower. Thanks for that. Really appreciate it. But honestly, I'm glad she said something, even if it was awkward, because at least it prepared me a tiny bit for what was coming, even though I had no idea what the heck she was talking about. But hemorrhoids are swollen blood vessels in and around your butt, and they're incredibly common during pregnancy and after birth. And what nobody explained to me in the hospital, hemorrhoids don't just appear during pushing and then disappear. It's not like they go out and come in. They can stick around for weeks, months, and years. And they can make every aspect of postpartum life miserable. The pain from the hemorrhoids isn't what I expected. I also had an episiotomy, and I promise you, I felt like my hemorrhoids were worse. Now, granted, I had a patch. I thought it would just hurt when I went poop, but mine caused this constant throbbing ache. And then they also itch, which is a real joy. Sitting felt like I was sitting on broken glass, and even laying on my side sometimes hurt because anytime I put any pressure near my butt, it was excruciating. I remember crying to my mom while I was trying to nurse Ian because I couldn't find a single position that didn't hurt, which led me to standing. And I had pillows, I had cushions, I had everything we could find in our house to make sitting bearable, but it just wasn't working. And like I said before, we didn't have Amazon back then, didn't know anything about a donut pillow, which I had. But the worst part is I was really too embarrassed to actually talk to anyone except for my mom and my doctor. And my doctor basically said it's normal. My mom pretty much said the same thing. And my doctor sent me home with absolutely nothing. But here's what I wish someone had told me in the hospital. Someone had told me at some point, this is the 3-step protocol that finally gave me relief. And I actually had step number 1 with me, and no one told me to put them on my freaking booty grapes. So step 1, witch hazel pads. Keep them in the fridge or the freezer and use them after every bathroom trip. The cold plus the witch hazel reduces the swelling fast. So what I do is I fold them over and I have my students and my mamas tuck them up in there so they're right on your hemorrhoids. This was the best thing ever when I had Hunter, and it made me feel like a human again, and I could actually bear these, like seriously. Step 2, stool softeners. I cannot stress this enough. I think my doctor sent me home with them with Ian, but he did not really give me instructions. No one gave me instructions that these would also help with the hemorrhoids. Like, I don't know, maybe they did. I was young, but take the stool softeners. Trust me on this. Take them. You need to start taking these immediately after you give birth and when you get home. So preventing constipation is crucial. If you're constipated now while you're pregnant, take the stool softeners. You can get them from the store. They're called Colace. Get the generic ones because any straining will increase your chance of hemorrhoids and afterwards will make them exponentially worse. Step 3, this is my favorite. I love sitz baths. This was the game changer for me. Fill your sitz bath. Now you can get them on Amazon. I have a favorite collapsible one that I'll link below. You can also ask your postpartum nurse and they will probably give you one as well. You're going to use your sitz bath. It comes with a bag and a tube. You're going to fill it with pretty hot-ish water, and you're going to fill up the bottom of the sitz bath. The tube sticks in there, and it's kind of like a little bubble bath for your booty. You can add a cup of Epsom salts and soak for 15 minutes a couple times a day. But if you just use water, you can do it as much as you want. That was the game changer when I had Hunter. It was also great for any stitches or repair that you might have, vaginal swelling, all of that. However, if your hemorrhoids are bleeding heavily, please let your provider know. If they're so painful that you cannot function, don't wait. Call your doctor and advocate for yourself. Sometimes they need to be treated medically with prescription cream or even a minor procedure, which I don't recommend. I've heard it's horrible. I suffered for 2 weeks with Ian. 2 weeks of hell. But with the rest of my babies, I knew what to do and how to advocate. And what I learned was you can actually prevent or decrease how bad your hemorrhoids get. And we're going to talk about that when we get to cause number 4, the one about birth positions that nobody tells you about, minus me. Now, hemorrhoids and cause number 3 are connected in a way I didn't understand until I saw a pelvic floor physical therapist. Understanding this connection made all the difference in the world for me. So let me tell you. Cause number 3 is a pelvic floor dysfunction. Your pelvic floor is a hammock of muscles, if you will, that support your bladder, your uterus, and your rectum. During pregnancy, these muscles stretch, and during birth, they stretch even more. And sometimes they tear, and sometimes they're just not working properly. But here's what's wild. Pelvic floor dysfunction can cause pain in your butt, your hips, your lower back, and even down your legs, because these muscles are connected to everything down there. And a lot of people, when you're having these random pains, you're blaming it on your epidural or maybe pushing positions. But when they're weak or overworked or tight, the surrounding muscles compensate, which create pain in these unexpected places. I used to think that pelvic floor issues were just about peeing and Kegels and all of that. I had no idea they could cause the deep aching pain in my glutes, in my tailbone, in my lower back. But my physical therapist explained it like this. Imagine a bridge with damaged support cables. The whole structure becomes unstable, if you will, and everything has to work overtime and harder to hold the bridge up. Now, here's where I need to be really clear. Kegels are not always the answer. In fact, a lot of times they aren't. And if your pelvic floor is too tight, which can be common after birth, which is what happened to me, Kegels can make things worse. So what you need is a proper pelvic floor assessment from a pelvic floor physical therapist. This is the single best investment in your recovery. I suggest to all of my students, over 15,000 students, I recommend they go during pregnancy for at least one checkup so we can get a baseline. But for sure, go during recovery. They're going to check whether your muscles are weak, tight, a combination, and they're going to give you personalized exercises just for you. But here's something you can do right now. Diaphragmatic breathing. So you're going to lay on your back, knees bent, one hand on your chest and one on your belly. And you're going to breathe in through your nose, letting your belly rise, and then breathe out through your mouth, letting your belly fall. Do this for 5 minutes twice a day. This helps relax and coordinate your pelvic floor muscles. Now, remember that connection I mentioned between hemorrhoids and pelvic floor dysfunction? Here it is. When your pelvic floor isn't working right, you strain more during bowel movements, which makes your hemorrhoids worse. But that's a simple position fix that helps both. And I'll show you that right after we cover cause number 4. The one your doctor probably, most likely, will not mention. Now, granted, let's hope that Trish can actually pronounce this right, but it's coccydynia. And this cause number 4 is the one that made me want to make this video in the first place because it's never talked about. Coccydynia from birth position is just the medical term for tailbone pain. But this specific type comes from the position you gave birth in, which y'all know I am always ranting about. Most hospital births happen with you lying on your back, legs in the stirrup. This position actually closes your pelvis by up to 30% and puts maximum pressure on your tailbone. It's literally the worst position for your tailbone, but it's the most common position in hospital births because guess what? It's convenient for the medical team. And inside of my courses and my community, I say nothing out of convenience or curiosity. Well, guess what? This one is convenient for someone else, not you. So compare that to squatting, hands and knees, side lying, where your pelvis can actually open fully and your tailbone, which is made to move out of the way, can move out of the way. But when you're flat on a bed, you can see it's not going to move. Women who give birth in upright or forward-leaning positions have significantly less tailbone trauma. And here's what makes me want to educate every stinking pregnant woman in the world is that most women don't know they have a choice in how they give birth. They think lying on their back is just how you do it. But you can request different positions. You can move during labor. That is how your body was made. And you can advocate for what your body needs. Pushing flat on your back is not good for you. Now, there are emergent times that it is necessary, but that's why you have to be educated. If you're pregnant and you haven't given birth yet, this is preventable. Practice different birth positions ahead of time. Include them in your birth plan. This is why we created the purposeful positioning course so that you could practice it with your playlist, with your essential oils, with your partner, that they are natural positions that you're used to. Tell your provider you want to avoid lying flat on your back unless it's medically necessary, not out of convenience. My favorite position is leaning over the back of the bed during contractions, like in a hands and knees, and then kind of leaning back to push, or even sideline. Both of those are my favorite. Those keep your pelvis open and protects your tailbone so that you're not experiencing tailbone pain, which really, truly sucks. Now, if you're dealing with this pain right now, everything I mentioned for cause number 1 applies here too. The donut cushion, the tilt and sit technique, and ice and heat therapy. But here's the important part. If your tailbone pain is severe and it's not improving after 6 weeks, you need to see a specialist. Sometimes the tailbone actually dislocates or fractures during birth, and we need to find that out because that requires specific treatment, and we're not covering that here. So speaking of things that might need medical intervention, cause number 5 is often confused with hemorrhoids, but it's actually way more serious. And if you have it, you need to know the warning signs because this one, cause number 5, anal fissures. These are small tears in the lining of your anus, and they cause sharp, knife-like, like you're getting sliced with a knife pain during and after bowel movements. So if you've ever thought, I'd rather go into labor again than go poop, you might have a fissure. These develop from constipation, from straining during pushing, or from the pressure of the actual delivery itself. The pain is very distinct. It's burning or tearing. It's very, very sharp that can last for hours after you go to the bathroom. Sometimes they bleed, which can also be scary, but so do hemorrhoids, but that's not usually dangerous. First, you've got to prevent constipation. Drink tons of water. I'm talking like 100 ounces a day. Eat high fiber foods like prunes, chia seeds, and leafy greens. Take your stool softener, girl. Take your stool softener. This is so important. Again, sitz baths, incredible. They help relax the muscles around the anus and they soothe the healing of the fissures. Third, get a squatty potty. I recommend this anyway, or a step stool. You don't have to have anything fancy, but just elevate your feet when you're going to the bathroom. This changes the angle of your rectum and makes bowel movements so much easier. So go ahead and get you something. Now, here's when you need to call your doctor. If the fissure doesn't heal in 6 weeks, if you're bleeding heavily, or if the pain is just so severe that nothing is helping you and you're avoiding bowel movements. Chronic fissures sometimes need creams or even a minor surgery. All right, you guys, we are almost done. 2 more causes to go. And both of these are sneaky little boogers because they don't seem related to your butt at all. So let's start with cause number 6. Cause number 6 is muscle strain from pushing. Think about it. During the pushing phase of labor, you're using muscles you've never used like this before. You're bearing down with incredible force. Girl, you are pushing out a human, and you're bearing down repeatedly. Sometimes for a first-time mom, that can be hours. Your glute muscles, your hip flexors, and your lower back muscles are all engaged and straining, which has never happened before. I remember after Ian, I had this deep bruised feeling in my glutes for weeks. It wasn't my tailbone and it wasn't internal. It was literally muscle soreness, like I had done 500 squats. The pain got worse when I stood up and down and climbing stairs because we lived in an apartment. So it was a little bit much. That first baby, y'all, that first baby. The fix, the best treatment for muscle strain is actually gentle movements and stretches, not rest. And I know you're probably like, no, I want to avoid that. That is not going to help me. But if you're not moving those muscles, they get more stiff and weak. So here are 3 stretches that I have since learned that I didn't know before. And you can Google these if you are listening and want to see them. Pigeon pose modified. So sit on the floor, one leg bent in front, the other extended back. Lean forward gently. Hold 30 seconds on each side. Number 2, figure 4 stretch. You're going to lie on your back, cross one ankle over the opposite knee, pull your legs towards your chest. And this stretches your glutes and the piriformis muscle. Number 3 is the cat-cow stretch on hands and knees. Now, if you've had a C-section, probably want to avoid some of these, but for those of you who haven't, cat-cow stretch is number 3 on hands and knees. Arch your back, then round it. This mobilizes your whole spine and your pelvis. Do these things 3 times a day, and within a week, you should feel that glute muscle stretching out and significant improvement. And remember the breathing technique I mentioned earlier for your pelvic floor. That is actually amazing to do for pregnancy and postpartum because that helps with muscle strain too, because it reduces the overall tension in your core and it helps you relax. By the way, this is where that technique from my later births comes in. During pushing, let your body guide you instead of purple pushing where you hold your breath, right? You are going to reduce muscle strain significantly. Just listen to your body. If you use open glottis pushing, which I have a podcast and a video, I believe, that we can link to, that is going to significantly reduce a lot of the strain. Okay, final cause. Y'all been waiting. This one is super duper rare, but we're going to talk about it anyway because y'all know I want you to have all the knowledge in the world. Nerve damage. And this is the pudendal nerve. I remember when I learned that in labor and delivery training where they said a pudendal block, and me and my coworker, literally, we were young, y'all, but we thought that was the funniest word we'd ever heard. We were trying to find every different reason we could use the word pudendal. But the pudendal damage is severe. This is number 7, and it's very, very rare. It's called pudendal neuralgia. And the pudendal nerve runs through your pelvis and controls sensations in your genitals, your anus, and part of your booty. During birth, this nerve can get compressed, stretched, or damaged. Now, again, this is very rare, but the pain from this is different from everything else I've mentioned. It's a burning, electric, or stabbing, and it gets worse throughout the day. So as you're moving and you're up and about, and it gets better when you're laying down. Some women describe it as sitting on a hot poker. Not fun. That is not fun at all. Here's the hard truth. This is not something you can just fix at home. So if you think that you have this, you need to speak to a specialist. You need to advocate the heck out of yourself with your provider because you need to see either a pelvic pain specialist or a neurologist. But the good news is that with proper treatment, most women see significant improvement. So the treatment usually involves a combination of nerve pain medication, nerve blocks, physical therapy, specifically for nerve pain, and sometimes Botox injections to relax those surrounding muscles. But here's what I want you to hear. Pudendal neuralgia is rare. super duper rare. The vast majority of postpartum butt pain is from one of the other 6 that I mentioned, which are totally treatable and also preventable. So girl, do not panic and assume you have nerve damage. But if your pain has those specific characteristics, burning, electric, sharp pain, worse with sitting, better lying down, and nothing else is helping, talk to your doctor. Now, of course, I'm going to give you a bonus fix that helps everything else before we wrap up. I want to give this to you because I adore you. You know that. But we're going to talk about something that helps all 7 causes, and that is an elevated feet position for everything, not just the bathroom. So here's the deal. Elevating your feet while sitting takes the pressure off your tailbone, your pelvic floor, and your glutes. So if you're having postpartum booty pain, even when you're sitting to nurse or just relaxing, putting your feet up on a small stool or a stack of something is going to help. This slight elevation changes the angle of your pelvis. Remember, I was showing your pelvis. Where's that at? It's going to change the angle of your pelvis and it distributes your weight differently. This is going to help you so much when you are just sitting or nursing or what have you. And the difference can often be immediate. Less tailbone pressure, less hemorrhoid pain, less everything. And it's such a simple change, but it makes a huge difference. It also helps with your healing of your vagina if you've had a repair or tears or what have you. Remember this, there is a connection between your pelvic floor and hemorrhoids. And this position also helps both because it reduces straining and pressure, which is a game changer. And most of you, the one that you're going to deal with the most is hemorrhoids. So hemorrhoids are the devil. Okay, let's recap quickly. 7 causes of postpartum butt pain. Tailbone trauma, like I had with Lainey. Hemorrhoids, which are not cauliflowers, which my nurse so elegantly pointed out with Ian. Pelvic floor dysfunction, birth position damage, anal fissures, muscle strain, and nerve damage. Each has specific fixes, and most of them are totally manageable. Some of them you can prevent, and some of them you may need some extra help outside of the home. But here's what I want you to take away from this training. When I was standing in my living room crying because I couldn't sit down to nurse my newborn, I felt so freaking alone. And we didn't have the internet back then. Y'all know I was born with the dinosaurs, okay? I thought something was super duper wrong with me because no one had ever told me they had to stand to nurse. I was embarrassed to talk about my butt. And I believed my doctor when he said, just wait it out. This is normal. But your pain is real. It's common. It's not something you just have to live with. I suffered for weeks and that was not necessary. And honestly, that was wrong. You don't have to do that. You now have information. Talk to your provider, advocate for yourself, see a pelvic floor physical therapist, try the fixes I mentioned, and most importantly, know that your body just went through something incredibly powerful and it deserves all the care and attention that you can give it. Thank you for listening or watching. And remember, I'm not here to scare you. I'm here to educate you so you can have the most empowered birth and recovery possible. I wish I would have had this level of education. You've got this. I am so proud of you. As always, hit subscribe, hit follow, leave a review, leave a comment, and I'll see you again next week. Bye for now.